Good afternoon and welcome to Back to Health during COVID-19 conversation. Every year, UI Cancer Center hosts and participates in Back to School Health Fair to raise awareness of importance of regular preventive care, including getting vaccinations and getting screening services. This year, COVID-19 has not only impacted our school system, but it has also interrupted our healthcare. Many health systems are operating with limited hours and limited access. Community members are not accessing regular care due to fear of contracting COVID-19. While COVID-19 is a big concern and has threatened our everyday lifestyle, we have to remember that if we are not maintaining and taking care of our regular health, we will soon be facing many other health concerns in addition to COVID-19. While we understand the importance of regular medical care, we also understand the dilemma our community members are facing in making the decisions to seek care or not to seek care. In today's conversation, we hope to be able to answer a few of the questions regarding back to school season. Should we be getting regular care, including getting our children vaccinated? How do we address dental care in this pandemic? And how to seek behavioral health services? Today's conversation is sponsored by UI Health, Chicago Cancer Health Equity Collaborative, and the Bristol-Myers Squibb Foundation. Before we get started, I would like to take a moment to let you know that today's conversation is being recorded. We have community members joining us via online and phone. Everyone is muted at this time, but you can type any questions you have into the chat box. For everyone on the phone, after the introduction, please feel free to unmute yourself pressing *6 and asking your question. Once done asking your question, please put yourself on mute again. Now, I'm really honored to introduce our panelists today. First, we have nurse practitioner Mallory Pierce. Unfortunately, nurse practitioner Dale Benton could not join us today due to a family emergency. However, we are very grateful to Ms. Peace for making herself available on such short notice. Ms. Peace is a family nurse practitioner at Miles Square Health Center with over 10 years of experience. In that time, she has served the South Shore and Englewood communities. She helps patients manage chronic illness, including asthma, diabetes, hypertension, depression. She is passionate about partnering with patients and their families to improve their health outcomes. Next on our panelist is Dr. Valentina Pacheco-Cornejo. She is a licensed clinical psychologist at Miles Square Health Center. She is culturally sensitive licensed clinical psychologist from Chicago who performs therapy and neuropsychological testing in both English and Spanish. Board certified in clinical child and adolescent psychology, Dr. Pacheco-Cornejo understands that in order to enact change at the child and adolescence level, you must engage system, including family, school, and/or court. Although trained as a generalist psychologist to serve children, teens, and adults, Dr. Pacheco-Cornejo has worked predominantly with children, adolescents, families in the communities, community health, hospital, school, and child advocacy centers. Finally, we have Dr. Sodabeh Etminan. She's the dental director at Miles Square Health Center. Dr. Etminan's philosophy of care embraces enhanced medical and dental integration for the most medically complex patients and increasing access to oral health services for vulnerable population. She's committed to shaping and influencing the future of oral health. Holding a faculty position at the University of Illinois College of Dentistry and serving on the National Advisory Committee for National Health Service Corps. As a public health practitioner, she leverages her frontline expertise to advocate for systemic change by participating on the clinical committee for the Illinois Primary Healthcare Association, the Switzer Fellowship Advisory Board, and sits on the Illinois Department of Public Health Task Force on Diversity in Healthcare. When not chairside, she enjoys working on projects that address social issues to promote healthcare outcomes. Welcome, Ms. Peace. Dr. Pacheco-Cornejo, and Dr. Etminan. To get started, I would like you to share a little bit about your field, importance of the service you provide, and changes you have implemented during COVID-19. Let's get started with Ms. Peace.
Okay, I'll start. Good evening, everybody. Thank you very much for the opportunity to be involved in this wonderful panel. As Nasima said, I am a family nurse practitioner. I've been in practice for 10 years. And I am, as a family medicine nurse practitioner, I see babies all the way up to adults and older adults. So I see everybody across the lifespan. And the importance of what I do is I practice primarily preventative care. I do manage patients if they have chronic illness, but my focus for the most part is wanting to make sure that you don't get sick. So you come to me if you have a little cold, if you have to have your physicals done for school, if you need to have a work physical done, if you are having a problem, if let's say you had asthma and at some point you needed to see the pulmonologist, but you're having problems seeing the pulmonologist, I can help facilitate you getting in to see the pulmonologist. A little bit about family nurse practitioners. I'm a registered nurse. I have advanced training, and I am able to diagnose. I am able to order labs if you need it, and I can also refer you to specialists if you need it. So I kind of do a lot, and I'm very happy to be focusing on making sure that patients are up to date with immunizations, and all of the kind of preventative testing and care that we recommend happen for people across the lifespan. And I know that the last 6 months have been pretty challenging for everybody. It's been unprecedented times. For most people, we've never seen a pandemic like this. I mean, there are a few people who were around when the Spanish flu was around, but most of us have never experienced this. But we have actually been working very diligently here at Miles Square to make sure that patients are safe and to continue to be preventative care and also care that our patients need here.
Thank you, Ms. Peace. Now, Dr. Pacheco-Cornejo.
Hi, everybody. So yes, I am a licensed clinical psychologist with specialty or really board certification, which is to say, yeah, specialist in child and adolescent psychology. Of course, as you know, in order to enact change at the child level, you have to include family systems. During this time, it's so interesting. More people seem to have mental health concerns because of being locked in their house or afraid of COVID, you know, coming to get them like the boogeyman, that it's something, you know, it's really hard. And so I'm really looking forward to giving you some strategies on how, you know, to reduce fear, how to, you know, improve coping strategies. In the end, I wish I was like, nurse practitioner piece where, you know, I could provide preventative care. Honestly, that is like my goal and my desire, but unfortunately the system, you know, from insurance to, of course, government is set up so that you really come to me if a problem is identified. Every once in a while I'll get a parent who will be like, you know what, can you see my other child just to make sure he's exhibiting some of the same, you know, symptoms, or for example, he's maybe even writing his letters backwards. And so that self-referral, depending on their insurance, would allow me to do preventative care. But unfortunately, most of what I do is you know, either treating a known disorder, you know, based on symptoms like depression, anxiety, disruptive behavior disorders, trauma, of course, even, or evaluating via testing, gold standard testing services to see if a child has ADHD versus learning disabilities, autism, intellectual disabilities. The really cool thing about me is because I've worked with multidisciplinary teams, have now learned how to identify when it is that a child has anxiety symptom disorder, symptoms that mimic that of ADHD, right? If you could imagine symptoms of inattention when thinking about the trauma you just experienced yesterday, or the difficulties you're gonna, be confronted with when you go home to whomever, could look like ADHD or inattention, and same with autism. It could be that some kind of sensory processing issue is causing the child to look less social, to be less interactive, So I'm able to tease out whether or not it's one thing versus these decade of the year disorders. So I'm looking forward to really delving in and speaking to you all, answering questions and really letting you know like what I do.
Thank you, Dr. Pacheco-Cornejo and Dr. Etminan.
Good evening, everyone. Thanks for having us on this panel. I think it's so great to get a multidisciplinary panel together, including dental and behavioral health and mental health services. Something that we do at Miles Square, our dental team, which I just rave about. We have the greatest dental team, from dentists to assistants. Everyone is just really amazing. If you have a toothache, we can take care of that, right? You come in and we'll be able to get you out of pain. But what Mallory touched on is we really do want to stress the importance of preventive visits, right? So you want to come in every 6 months to get a cleaning. You want to come in every 6 months for even something like an oral cancer check, right? Something that we can get into a little bit later is that head and neck cancers have some of the lowest survival rates because they're oftentimes not diagnosed or noticed until it's a little bit too late in the process. So being able to get to your dentist every 6 months to see them is very, very important. And I also wanted to add that at Miles Square, our dental services are also offered on the same sliding scale fee as medical services. So I know for many people, they may have medical insurance, but not dental insurance. And we don't want that to be a barrier to care. So you would fill out a sliding fee form just like you would for medical services. Things we do, we make dentures. We make crowns, we do extractions, we have nitrous oxide sedation for anxiety and special needs patients. So we do offer a very robust set of services. We actually get a lot of other referrals from other health centers because we offer like a very wide range of services. Currently, our flagship location is at the South Shore site, which is at 7037 South Stony Island. However, we do have some services available at the other sites on a rotating basis. So certain days of the week, we're at different sites. We were at Englewood on Thursdays, we're at Back of the Yards on Tuesdays and Fridays, and we're at the main site at 1220 Southwood on Mondays. And when we travel to the other sites, we do tend to prioritize your children. But if you're an urgent adult, we can definitely get you in as well. A little about myself. I've been doing this for a little over 10 years. I grew up in Rockford. I actually started as a dental assistant back in the day, and then I liked it so much I decided to kind of keep going and make it my terminal degree. I live in Oak Park, and I went to school at the University of Pennsylvania. But I definitely have very close ties to UIC because I did my undergrad and my MPH here. I'm excited I like these question answer formats. I'm excited to see what good questions you guys come up with.
Thank you. Thank you, Ms. Peace, Dr. Pacheco-Cornejo, and Dr. Etminan for that discussion. Now this leads us directly to our question and answer portion of the conversation. I would like to remind everybody, please do feel free to put your questions in the chat, and those that are on the phone, please feel free to unmute yourself and ask your questions. In the meantime, I will dive into questions that were submitted during registration. So the first question is for you, Ms. Peace. Some of us come from communities where adults and children do not see doctors unless they are sick. Why is it important for us to get regular medical care?
So the reason why it's important to have regular medical care is one, the biggest one for me is to establish a relationship with a medical provider. Because with that relationship, we can learn about you, We can learn about your family. You can learn about your family's history. And knowing about your family's history and knowing about you will help me know when something is wrong. So, you know, if you're somebody who's usually bubbly and then you're coming in and your mood is a little off, you're not as engaged as you normally are, that in and of itself, just looking at you, gives me a clue something's not right here. So establishing that relationship is very important because you start to learn, you can ask questions of me so that you can get information. Sometimes patients have come to me and have all kinds of questions about things like vaccines, questions about kind of general medical things, and it helps me to give you good information. You can ask questions, and then you can go from there. So it helps to establish trust. And I want you to trust me so that you can come to me when you have a problem. So that is the reason why preventative care is so important. And that is important for you to have and come and see me before you get sick. So that when you do get sick or are having a problem, you can certainly know that you're gonna be able to get the good information that you need and the care that you need. And then I can also refer you to wonderful other panelists here. So I know Dr. Etminan and Dr. Pacheco-Cornejo. I wanted to say that earlier. So that's the other thing about family medicine is that we can also, because we don't work in a team, I can always refer you to these wonderful, wonderful clinicians.
Thank you. The next question is for Dr. Pacheco-Cornejo. This question says, my community does not believe in mental health, especially now. There are more children and parents spending time together and they are with each other. Why would one need behavioral, mental, or emotional health support now?
Yeah, honestly, it's interesting because as a psychologist who clearly must believe, I mean, does believe in the usefulness and effectiveness of therapy and testing services, think like, if I needed it, would I seek it? And a couple of years ago, the answer would have been no. The answer is only yes now because I'm figuring I would be able to identify somebody who looks like me or understands at least my culture, you know. So I get where the person is coming from about their cultural background, you know what I'm saying, and how they were raised and impacting their interest in seeking services. Now, I think what'll motivate you past cultural background, upbringing would be if your child or your spouse or a family member that you love dearly was suffering from some kind of depression or anxiety or trauma. I mean, trauma can happen to anybody, right? Like, just like you don't know if this is your last day of life, you don't know if you're going to get in a car accident or you're going to witness a car accident, and that leaves you, you know, afraid to get in the cars. I mean, that will totally screw up your life, right? If your job isn't within walking distance. Same with if your family isn't within walking distance. So in the end, it really, life is what'll do it if you don't have a family member who really grew tremendously from having participated in therapy. And even I want to not leave out testing services, because I think that when people think of mental health, they think of the sort of TV media disorders, like even like I keep saying, the depressions and anxieties. And so naturally therapy comes to mind. But a person like me who's a psychologist, which is a doctor of psychology, who went to school for beyond 4 years of a bachelor's degree, 5 years of grad school to earn that doctorate degree, I learned both therapy and testing and skills. And testing would be sought, especially nowadays, for these hot disorders like ADHD and autism, as well as learning disorders. And so really, again, it's one of those things where it's like if it's impacting your child's academic performance or even your performance on a job because you can't remember the tasks that were assigned to you without having to jot everything down, you know, it just is what it is. You're gonna hopefully seek out help, because with that confirmatory diagnosis comes accommodations, my ability to, you know, help you petition the child's school for accommodations, or even your employer, you know, whether that's more time to complete work or less work, or if it's a learning disability, it would be some kind of individualized instruction around math, reading, writing. Now, during this time, especially, kind of like what I was getting at in my introduction, people who have never had disorders in their lives, right, who wouldn't otherwise be predisposed or at risk, are coming down with symptoms of depression, so that they wouldn't quite meet the criteria for like a major depressive disorder or persistent depressive disorder, but perhaps an adjustment disorder with depressed mood. You know, because they're just stuck in the house, or even a adjustment disorder with anxious mood because they're afraid to go out, you know, and even think about like grief and loss, you know, during this time, not being able to appropriately grieve or seemingly appropriately grieve the loss of a loved one because of restrictions, you know, on funeral home, you know, so visitors. So it's just, in the end, you know, if experiences with someone else won't do it, life itself, you know, may. But if you have coping strategies, honestly, you can probably stay away from therapy, right? Like you can, you know, if you have a good family system, good support system, friends at least, who will lend a listening ear.
What the heck? Jordan!
I didn't know if that, oh, okay, I think that was a mistake. I thought that was a question at first from Jessica. I was hoping that was a question. Okay, so yeah, you know, in the end, and I think this is a good stopping point for me, like family, friends, church, you know, even a job, like can keep you somewhat sane, right? Like there's people who are making excuses to go to the grocery store because they just needed to get out, right? And you went yesterday, right? So you know, I mean, whatever you kind of have to do that's healthy, right? To keep your sanity.
Thank you, Dr. Pacheco-Cornejo. Now this question is for Dr. Etminan. So we hear about this 6 months. We need to go to dentist every 6 months for checkup. At what age should we start receiving dental care, and why?
So we actually, and our dentists are trained to see babies pretty much from birth. And we actually start before birth because we start with the OB patients, right? The moms before they give birth. And the reason why we do that is because a baby's not going to pop out and start brushing its own teeth. So that's up to the moms and the dads to help set that example and guidance. And we also want to go over healthy diet habits. What can you put in the bottle? You know, why juice is not such a great idea. And things like that. And that kind of education and answering those questions happens at a younger age. Or it happens even when we talk to the moms. A lot of times, and this is something Mallory touched on that I just loved, is building that relationship and that trust so that they can come to us and talk to us about any questions, because we are the healthcare provider for the family. And so we have this lengthy relationship with you. So we try to focus on getting a child in to see the dentist before age 1, if possible. We actually have this great program where while the pregnant women are in the office to get their gestational diabetes testing and they're sitting there for 45 minutes, come on back and get a dental cleaning. It works out beautifully because the safest time for your baby to get dental work done is during the 2nd trimester. And that's also the same time that they do the gestational diabetes testing, is at the beginning of the 2nd trimester. So we try to do what we can to work as cohesively with medical to make your time that you come into the clinic as efficient as possible, right? And we've received grants, and we've been highlighted for some of our work and some of our efforts in getting the children in, and I hope you guys feel comfortable bringing your kids in at a young age.
Sounds great. Well, thank you for that. And the next question also goes to you, Dr. Etminan, is so everybody is munching more these days and having a diet change because of staying home, especially children. What recommendation do you have for dental care for everybody that's staying home and munching more?
Sure. And this is like, I've heard this like memes about the COVID-19, meaning like the 19 pounds that you put on during quarantine because you're sitting around. You're more sedentary, you're not walking to the car, so you're gaining the COVID-19. And that goes for your teeth as well. And I think something that we talk about with our parents and something that they don't realize is hidden sugar is everywhere. I mean, there's sugar in your bread. You think you're healthy by eating a Yoplait. There's so much sugar in a Yoplait. So while you're sitting there and you think you're giving your kids a healthy snack like a granola bar, I mean, not all granola bars are created equally, right? So it is a little bit more challenging as parents to think about what you're purchasing and what snacks you're having in the house for yourself and for your kids. But there's definitely ways to have some diet choices that are not just empty calories and are more nutritious and can actually fill you up and are economical at the same time. So definitely looking out for that. I also wanted to share and put a plug in, Naseema, if you don't mind. We have a food pantry program for the patients at Miles Square, and we are getting referrals from your primary care provider, but please reach out if you're having any food insecurity issues, especially during the pandemic. I know during the civil unrest in the city, a lot of corner stores had closed and they still have not recovered. So if you're having a hard time getting food issues met, like we can help you here at Miles Square. Our food delivery program has delivered, and we deliver the food to you. We've delivered over 5,000 boxes of food since May. So the program is still going strong, and make sure to bring that up to your provider if you're having any issues.
Thank you. Thank you for that information. I'm glad you gave us.
Naseema, we have a question over in the Q&A. I want to make sure that we don't miss that.
Yes, no, I think that question is actually going to go to Ms. Peace.
Mm-hmm.
If it is not an emergency, should I be bringing my children in for any preventive care during this pandemic?
Yes, especially if your child is, especially if it's an infant. Because for infants at that 2, 4, 6 month child visits, we're doing immunizations. Immunizations are still very much important at this time, simply because I think what the coronavirus has shown us is that people are very mobile, and the virus has traveled with people. And so there are still parts of the world where a lot of the vaccines that we're giving here in the States are endemic in other places. And so with people moving, there's a possibility that we could come in contact with these viruses or diseases. So it's still very much important that we're having the infants come in for their child visits to get their vaccines. For the schools, particularly CPS, because I deal with a lot of children who are in CPS schools, the schools are still requiring that children have their health examinations and having their forms completed, and still having to see the dentist before they go enroll in school, and having their eye exams before they come into school. So yes, please come in and see us. It is still very important with the pandemic that you come in for those routine visits, and we have made the clinic extremely safe for patients to come in. We have protocols around screening patients when they come in to see if there are any acute issues that need to be addressed. But otherwise, we are doing the social distancing. Everyone in the clinic wears a mask. Including patients. All of our staff wear masks, and all of our staff are also socially distancing. So we have made a very safe environment here for patients to come in to be seen for their routine care.
Thank you, Ms. Peace. In addition to that, I know you went a little bit on vaccines, so I'm going to add the next question that is on there. And it's, could you also talk about the importance of flu vaccine this year?
So even though coronavirus is the virus that's on our minds, flu virus is coming. The flu virus actually moves around the world, and every time around this time every year, so October all the way into March, sometimes into April, the flu virus shows up. And the flu virus it takes lives every year. And it is very important that you are getting your flu shot. Particularly for patients who are asthmatic, or people who have other respiratory illnesses, it's very important that you get your flu shot because the flu is a respiratory illness. And the flu vaccine helps to prevent you from having severe symptoms. Either you won't get the flu at all, or you would get a very, very mild illness. So flu doesn't go away even though coronavirus is here. That's what I want you to know. So please come get your flu shot. And it's safe. Most people don't have any problems with it. So.
Okay, I will keep the attention on you still. There's a follow-up vaccination question, which is, I never get the flu shot for my kids. Do you think it is a good idea to get the flu shots now since COVID is around? So I think you answered yes already, so I'll give you.
So yes, please come get your flu shot. Even though coronavirus is still around, it is really important to get your flu shot. So the coronavirus is a respiratory illness. Flu virus is a respiratory illness. And so we want to minimize the impact that our respiratory system has to deal with these kinds of things. So please, yes, get your flu shot.
Okay, thank you so much. Now the next question is for Dr. Pacheco-Cornejo. This question says, how can we identify stress from this pandemic in preschool-aged children? Hard to tell.
Yeah, it could be hard to tell if the child is already anxious, right? Already struggling with stress, because then you're like, okay, is there really a difference? Maybe yes, if it's increased. Now, if you're saying that the child wasn't anxious, like they didn't, and really, I guess hard to tell also is because with their age, they're not as verbal or as clear, you know, they don't have the words, right, to say I'm stressed or I'm anxious or I'm scared. You may hear I'm scared, but usually what children do to demonstrate that they're struggling with stress is they have somatic complaints, right? They have physical complaints. It's almost like because they don't have an outlet through their words to talk about it, which is really why therapy is effective, is because you get to talk that stuff out, get that stuff out, and with somebody who understands you, right? Who makes you feel like you're not crazy, who really confirms for you that you're not crazy. So because they aren't getting it out, because they don't have the words at that age, it's still in them. And because the body is trying to free itself from that, basically it shows up in these physical symptoms like stomach aches, headaches, you know, and honestly, unless if your child wasn't doing that previously, then it's safe to say, okay, this child is stressed. One of the reasons why they may be stressed, especially during these times, is because they're being required to stay in the house. And so what I tell my clients, and because, you know, parents are listening to the news and they're trusting and they're everything that they're hearing, but the media, it's because there's a goal out there for people to stay safe. The perception is that that's the goal, for people to stay safe. Then they're saying stay in your house because you could then reduce the spread, except to stay in your house is to not get sun. And sun, of course, you know, produces that vitamin C in you, vitamin D, D for David, which is known to fight diseases and promote, fight disease, promotes health. So fights diseases and it fights stress and depression, you know, those type of symptoms. So what I've been telling my clients is, like a medium, right? Like, okay, fine, don't necessarily take them to the park, but go out in your yard. If you don't have a yard, sit on the porch. If you don't have a porch, walk around the block. You know, they just have to get out. That's probably part of the stress, is that they're children who need physical activity. I mean, even the schools know this, right? That's why gym class and recess is a part of their day, you know, breaks. And so, so I don't just want to like give you the symptoms, the signs that the child is stressed. I also am trying right now to give you some strategies on how to decrease that stress if it truly is presenting itself physically with stomach aches and headaches. So I would say definitely walk around the block, get out, into the yard. Of course, we're not hearing anything about how to boost our immune system. It's just everything is social distance. And now that's being changed to physical distance because, of course, we're criticizing that because we're social beings. We need to be social, that's what makes us human. So yeah, it would be like, getting foods that are high in, are kind of like antiviral, right? They have antiviral properties, these herbs and these, I also have a certification as a mental health integrated medicine provider. So I'm thinking about like oregano oils and, just different foods, citrus foods that you probably are already aware of, like mangoes and, oranges, apples even, right? You probably heard the saying, an apple a day keeps the doctor away. Like, this stuff is real, our families were, our grandparents, our great-grandparents were right, So that's not to say to disregard what nurse practitioner Peace said. It's just to say that, she's promoting preventative care as well, just like even our the dentist, is telling us, that these are things that we want to do so that when we get that checkup, it's kind of like, oh, okay, less recommendations than what would otherwise be provided if you weren't doing anything on your own because you just didn't know what to do, So I hope I answered the question. Definitely type in a follow-up if that wasn't clear or if you have another thought.
And can I add that yes, you might see these so we call them psychosomatic symptoms in children, but I also see them in adults. So people coming in, I mean, this is happening, and I'm seeing this often over the last 6 months: headaches, abdominal pain, increased complaints of pain. So it's not just children who will show up with physical complaints of stress.
That is so true. Thank you for saying that, because you're right. I personally have family members who are talking about rapid heart racing, and and we know that a panic attack feels like a heart attack. So very great point. Thank you so much for saying that. I'm just, my mind, I was just focused on like the question. And then of course I'm more child based. So I'm like, yeah, my babies, let's talk about them. But you are real, like that's right. And these adults are parents of these children. So in the end, we have to take care of our adults too, Great point.
Thank you. Thank you to both of you. The next question we are going to ask is for Dr. Etminan. What should patients expect different at their dental visit now in comparison to before COVID-19?
That is a very, very good question. And I saw a question in the chat box about whether or not masks are adequate to keep the students safe at school. And so my answer is going to tie both of that together. So things we have done at the Mile Square practices, and specifically at the dental practice, is we're doing things like keeping spacers in between seats in the waiting room, right? So not having as many people in the waiting room, asking people to possibly wait in their car or wait outside if they show up a little bit early to the appointment. When we call to confirm our patients, we let them know, let's not bring all the kids and all the parents. Let's just try to limit the number of people that we're bringing into the clinic, so that we are limiting the number of people around and limiting the spread. So these are physical things that we are doing before we even get down to the antimicrobial, antiviral things that we're doing. Another point I wanted to add is we're screening everybody who comes into the clinic, dental, medical, anybody. So we are taking your temperature, we're asking you some questions. A medical assistant or a nurse is going to be screening you to make sure all the people that are in the waiting room with you, all the people that are getting care in that building, have successfully passed that screening test. And that goes for staff too. We have our temperatures taken twice a day. We have to answer those same screening questions as well. So you can be sure that your staff, the people in the building, are all successfully going through that screening process. let's say they don't go through the screening process. They do have a temperature. They do have answer positively to some questions. So what we do at that point is we put you in a special isolation room so that we can further determine what's going on. You say you have a cough. Well, then we'll further investigate. Is that due to asthma? Is that due to allergies? Do you need a nebulizer treatment because you're short of breath? Something people don't seem to realize is that every cough and sniffle isn't necessarily COVID, right? It could be something else. But until we know whether or not it is something else, we are going to separate you from the general population to make sure that we can keep you safe. And another thing that we did at our dental clinic is the CDC actually has guidelines for air exchanges and air filtration. And we have air filters installed at all of our sites where we do dental care. They're medical grade HEPA filters that actually filter out viral particles. So you can be sure that the air that you're breathing in is clean. And so with all of these things in place, and with your employees wearing their masks and their gloves, and with you wearing a mask and a glove, we have not been a source of infection. We've been able to keep everybody safe. And that goes to that question about whether or not masks in school keep kids safe. I'm going to say it depends, right? If that school is also doing temperature checks and is also doing screenings and is also taking those precautionary measures, maybe changing up their HVAC system to make sure that the air in classroom A isn't going into classroom B and potentially, getting all of those kids sick if one of the children in classroom A is sick. These are all things that that as parents, I have kids in school, I want to ask and I want to be sure that we're following proper guidelines. So if you could just think simply wearing a mask is going to be enough, the answer is no, but you do want to make sure other precautionary things are being taken. You don't want 40 kids in a classroom anymore. You don't want kids crammed in a lunchroom eating lunch together anymore. It doesn't matter if they wear masks all day. If you put 200 kids in a lunchroom and have them all, eating and sharing, they share food. That's going to be an issue. So just making sure that those proper precautions are in place is very important. That's something we took very seriously at Mile Square. We met with engineers. We did all of this as soon as the virus came out so that we were ready to reopen as soon as it was safe to do so.
Thank you. Thank you for tying both questions together and answering it. So we are going to go to the next set of questions now. This is actually cancer-related question for the team. So first, it's for Ms. Peace. How does primary care and regular medical care tie into cancer screening and prevention?
So that's a really good question, and there are lots of ways. We were talking about children and we're talking about immunizations. So there are vaccines. There are a couple of vaccines that we administer to children. And if adults haven't had these vaccines that we can administer that protect against cancer, that would be the HPV, which is the human papillomavirus, which can cause cervical cancers, oral cancers, sonogenital cancer, and then the hepatitis B, which infants get at birth, and then along the schedule when they come in as an infant. So that is one way that we prevent cancers with vaccines. The other way that we prevent cancers is that we counsel about smoking. Smoking is probably the worst thing you could ever do for yourself, so we want you not to smoke. And every time you have a visit with me, I ask about smoking, and if you smoke, I will tell you, please don't smoke, and what can I do to help you to stop smoking? So that is another part of preventative care that addresses cancer care or cancer prevention. And then there are certain screenings that should be done depending on how old you are and also on your family history. So if somebody has a family history of breast cancer, colon cancer, and a family member, like a first-degree family member, meaning your mother, your father, your grandparents, and they had that cancer before age 50, then I would say, oh, we might have to have a conversation to have you see the geneticist, or we have you start doing the typical screenings for the normal age group a little bit earlier. So for patients who are 40 and older, particularly our women, our female patients, we start screening for breast cancer at age 40. But like I said, if you have the family history, we might have you do it a little bit sooner. And at age 50, we start screening for colon cancer. And so I would have you go either for your colonoscopy, or there's actually a stool sample that we can collect and do a test in the clinic to screen you for colon cancer. But again, if you have a family history, we're doing it a little bit sooner. So that's why it's important to come and talk with me before you get sick.
Thank you for that. And Dr. Etminan, how does dental care tie into cancer prevention or cancer screening?
So much. I am jumping up and down and doing the happy dance when Mallory said, you know, smoking is one of the worst things that you can do, because we ask about tobacco use. We have these amazing tobacco cessation counselors that can help you. You know, it takes, I think, 7 tries on average before you quit. So don't give up. You know, if you fall off the wagon, just keep trying and keep that as a goal, because tobacco use is one of the biggest risk factors for cancer. Unfortunately, head and neck cancer has a 50% survival rate in 5 years. It disproportionately affects African American men over the age of 40. So we just want to make sure everybody comes in and gets screened. But if you fall into one of these high risk categories of tobacco use, alcohol use, no HPV vaccine, if you fall into a certain demographic category, we are going to want you to get screened more often. The number of deaths per year from head and neck cancer actually add up to 1 person per hour every single day, 24 hours a day. So, you know, we've had patients that have come in and they'd be like, yeah, I had this sore spot on my tongue. I thought I burned it from pizza. It's been a couple of months and it hasn't gone away yet. And, you know, when we biopsy it, it does turn out to be cancer. I mean, that's how these things start. And, you know, I always tell patients, and I know they talk about that with breast cancer too, like, I only see you a couple times a year, but you see yourself every day. So you need to be looking in the mirror when you brush your teeth, or doing your self exams or your self breast exams. If you notice anything a little bit off, if you notice sore spots that aren't healing within, you know, a few weeks time, that's a reason to pick up the phone and come see somebody to get it checked out. You might be hesitant, or your appointment might have gotten canceled because of COVID, but it's not too late to pick up the phone and set up a preventive appointment. So if everyone leaves here and does one thing, I want you to set up a preventive visit with your doctor, with your dentist. If you see a mental health professional, make sure you get in to see them, and don't let that slip by the wayside.
Thank you for that. And Dr. Pacheco-Cornejo, so right now survivors are dealing with cancer treatment and isolation. Are these some things that behavioral health or somebody in your profession could help address, you know, coping cancer and COVID-19? And also, do you have any message for survivors who might be listening right now?
Who might be what? Say that again.
Who might be listening?
Oh, yes. Okay. Yes. So definitely mental health plays a role. I mean, it's if a person is going through cancer, oftentimes, you know, if they have a cancer diagnosis, oftentimes it's scary. It changes, you know, their lives, especially if there's pain involved. So psychologists are known to help with pain management. They're known, of course, especially health service psychologists that co-currently help with the medical issue, the behavioral health issue that is secondary to the medical, you know, primary issue. Yeah, definitely there's a role that psychologists have, even if it's helping a family member understand what the person with cancer is going through. Perhaps it's, you know, supporting their family member. You know, there's definitely a role. During this time where people can't, you know, I know there was a point where, like, you know, the only appointments that were being offered medically were like vaccine, you know, the vaccine appointments, you know, I was hearing things about, and maybe, you know, my colleagues could correct me if I'm wrong, but I remember hearing sometime within the pandemic, you know, that surgeries were canceled, and, you know, and I can imagine even how that would have impacted a person with a cancer diagnosis who might have had, you know, an appointment. And so during that time, I'm sure that, you know, that person would have been looking for some kind of suggestions, whether it was coming from a mental health professional, a pastor, you know, churches were online, if at all, you know. So I know that time, maybe a friend, but via online, so or virtual. So it really the best thing that a person can do when they can't get into some kind of therapy, or they're thinking that the concern isn't, severe enough to warrant therapy, is to talk to friends, because when you talk the stuff out to somebody who, can will listen and will support you, you almost, it's like a release, and especially if they don't have you feeling like you're crazy, it's a release. So that's really the best advice there is connecting with somebody. Now for people who don't have that kind of support at all, I mean, it's definitely like get out and secure a mental health visit. The cool thing about Miles Square Health Center is it's UIC's federally qualified health center. So we see individuals regardless of ability to pay. You can be uninsured, underinsured, Medicaid, Medicare, like we will see you. Now, if we can't see you for whatever reason because we just can't get you in within the month because we're booked, then we have a list of referrals to counseling centers that go with each of the 5 Mile Square sites, so that if the South Shore location is more convenient for you, or the main location is more convenient, and we can't see you there, we can give you a list of places that's in that area, that can see you, taking the same type of insurance or no insurance, providing the same type of services, service as far as therapy goes. Did that answer the question?
Yes, that definitely did answer the question. So we have a question in the chat.
Nasima, can I just jump in? So
Sure.
the other part of preventative care and here at Miles Square is that whenever you are coming in for a visit we're screening for depression. So every time you come in for a visit with myself or any one of the other providers here at Miles Square, when you see the nurse who comes to take your vital signs and ask you what's bringing you in today, he or she is gonna ask you 2 questions. And so that's a screening, and that'll give us an idea of whether we need to investigate a little bit farther about how you're feeling based on how you're answering. So that is something. So I don't want you to think that we just have you how you can kind of get in to see Dr. Pacheco-Cornejo. The first entry is really a primary care provider.
Okay, thank you.
I wanted to add one other thing about the cancer. Having pap smears every 3 to 5 years is another way to prevent cancer. So.
Okay, thank you so much. There is a question that this is either Dr. Etminan or Ms. Peace, if you can take this. It's what is the impact of secondhand smoking to the family or friends close to someone who smokes?
It can be quite great. So there has been research that shows for infants, it increases the risk of ear infections. And if somebody has asthma, it can exacerbate their asthma symptoms. And if I'm not mistaken, there have been studies where patients or family members of a smoker who was not a smoker can develop lung cancer. And there's also a genetic condition too that can also put you at risk for somebody who's exposed to secondhand smoke. So the risk can be pretty significant.
Okay, thank you for that. So I know our time is coming to a close to an end. However, there's 2 more questions I'm going to go ahead and ask. And if any audience have any last questions, please do feel free to ask it. So as we come to an end, we can answer everybody's questions. Now, Ms. Peace, this is for you. I'm afraid of my children or myself contracting COVID-19 at a doctor's office. Isn't it better for me to wait until COVID-19 passes before I go back for care?
I would say no, not to wait for your preventative care. At least here at Miles Square, we have actually gone back to full schedules. We also have introduced telehealth visits into our practice. So there are ways to get care. But Dr. Etminan, she mentioned the processes and the protocols that we have here at Miles Square when patients come come for their visits. And that those protocols are in place at all of the Miles Square sites. They're in place at all of the UI Health clinics down on Taylor Street. Like Dr. Edmonds said, you come in, you get a temperature taken, you get questions asked, If you answer yes to any of those questions, you immediately go into an isolation room. A provider still will talk with you and do an assessment over the phone. And then if we deem we need to do more testing, we'll do that. And then the social distancing is maintained, even in our waiting areas. So we do have those protocols in place to make you safe when you're here in the clinic. So we encourage you to come in for your preventative care visits.
Okay, thank you. Dr. Pacheco-Cornejo, this question is actually for you. And you actually earlier started having this discussion. It was about COVID-19 has made it hard to say goodbye to our loved one. What would your advice be on how to grieve loss of loved ones during the current times?
Oh, that's a really good question. I think that part of what would help a person during this time is they're thinking about their understanding of death. So if a person believes that, you know, that there's no more suffering, you know, then that could really help the individual grieve, you know, in a sort of really healthy way, right? Like my belief is totally connected to my religious affiliation, spiritual affiliation, which is Christian. So for me, I'm very clear that about the fact that when people die, they literally are resting in peace. There is no suffering. There is no remembrance. I mean, it's on one end, it could be sad because it's like, oh, like for example, I lost my mom. So I'll use that case as my example. Like I lost my mom passed away 10 years ago, and I've had 2 children since then. So on one end, it's like, you know, it's sad that she has no remembrance because she doesn't know that you know, for me, right? Not sad for her, because she doesn't know that I have 2 babies. But it's also good that she has no remembrance because she doesn't know what's going on. She can't be stressed out and feeling like she can't do anything because she's deceased and not in the body, you know. And so I think that understanding of death, like basically in the end, your understanding of the concept is what helps you have peace through it, any concept. And so as it relates to death, because I believe what the Bible says about people who are dead are no longer suffering, they're at peace, they're sleeping, they don't have any remembrance, not even anger or stress, then it's like on one end, I have a great peace that she's no longer suffering, especially if what took them out was some kind of cancer or health condition, you know. But on the other end, you know, especially as it relates to the times now where you can't actually attend, you know, the funeral, and I'm hearing that things are changing with that, you know, there's the capacity, right, on people has increased. So it's no longer at like less than 10. But I know like people have been getting very creative. So just as our health center provides telehealth services and in-person visits, depending on what's needed or how comfortable the client is, same with families who've lost loved ones. There's a lot of people who are doing virtual, homegoing services. And so, if you insist, like, right, this is your mom or this is your, somebody, your grandmother, a close aunt, and you insist, like, then try to, right, be there in person. But if it's something where it's not possible, then because of your fear or because of just the capacity of what, is allowed and the number of family members you have, then maybe doing like some kind of virtual homegoing service. Of course, there's also doing things in remembrance of the family member, to honor their spirit or honor, just their life. And so it could be, people donate to the causes that the individual would have, been passionate about, or maybe they have like maybe they still celebrate their birthdays with a huge party, or, there's all types of, things that really can be done to grieve the process. definitely, like I've been saying before, talking and stuff out, right? Getting it out, crying, being okay with crying. But there's cultural factors that keep us from doing that oftentimes, right? Especially if you're male, it could be, you know, that's weak or that's soft, or even if you're female, you may not want to cry in front of your children or your spouse, your loved ones, because you think that that's going to somehow sadden them. But that is a complete lie. And I just have to be, you know, just as honest as I can with that, because I only have a short amount of time to get through to you, you know. That is a lie that was passed down either from generation to generation or from culture, you know. And so we learn it from the media, we learn it from movies. In the end, it's a lie. You want to cry, because to cry is to say that I am sad. It's to say that I miss that person. It's to be honest and truthful about what you're going through. And it also gives permission to the person that you're crying with or in front of to also cry and grieve. I mean, this is a time where you need to get it out, because grief and loss can actually turn into, or bereavement, you know, the clinical technical term, can actually turn into depression if not done healthily, right? Now, of course, I have in mind, like, you don't want to just be crying all the time, because that's not healthy either. And so, you know, maybe get out or engage in an activity or do something to get your mind off of it, right? I did the same thing when my mom passed. You know, that was my best friend, like for real, you know. So there is definitely an in between. You want to grieve, but you also don't want to be isolating yourself, so that now you're engaging in symptoms and behaviors that will promote depression, you know. So be honest with yourself, but don't get sucked in, because in the end, what would that person want you to do anyway, right? Is live, is move on, you know, yeah.
Thank you for that. And in the interest of time, we're going to go ahead and take one last question. And this is again going to go for you, Dr. Pacheco-Cornejo. This will be the last question of the day, and it actually goes with our theme really well. And this is asking about learning online. So now it's learning online is hard for kids. Every time the computer, tablet, or phone is pulled out, my children are excited about watching TV. What can I do to prepare my child for online learning?
Ooh, okay, so we need a whole hour for that question alone. But no,
Let's have it short.
It's very, the AAP, the American Academy of Pediatrics, were very clear about their recommendations on electronic use, which is, I think, like 1 to 2 hours or something like that, you know, a night. Now, I know there's been a change recently, I think, to accommodate what's going on in the world now, and so that it's saying now it's on a case-by-case basis, but really we're all in the case. We're all the case, you know. So it's so hard, because in the end, this situation it's almost like forcing us to go against what we know is healthy, but it's for the better good, right? So in the end, you don't want to take away your child's fun screen time because they were online for 4 or 5 hours because of school, but I guess one of the things you can do is you can see how it goes. Actually, I guess you would have had the opportunity to see how it went in the spring. And so if your child gets headaches, like I have a client whose migraines are exacerbated or worsened by electronic use, screen time, excessive screen time, which is what was happening with this online school. And so what I did was help the mom petition the school for accommodations. See, special education accommodations aren't just for children who have autism or learning disabilities or ADHD or even depression, right? Like, you can get accommodations for depression. It's also for things like, you know, anything really that impacts learning. And so because she was online in front of a screen for all of those hours during the spring, she then couldn't actually interact with families. She couldn't have any light, sound, like she literally would just go under the covers and sleep for that day. And the mom noticed, like on days that her child had more screen time, this is what would happen. The child wasn't like that prior to COVID. And I understand that there's other factors that might make people think like, oh, perhaps it was being locked in the house, but they weren't, you know. So it was just very clear that it was her migraines were worsened by the screen time. And so I helped the mom get accommodations, which looked like less schoolwork, more time to complete schoolwork, hand, paper, you know, physical, actual assignments. And these are things that you all can get for your children, whether they have headaches because they're in front of the screen or not. Just because you just know that all that time in front of the screen is not okay, it's not healthy. And the one way that you can petition a school is by doing a search online for how to request accommodations from the school. I won't even use jargon, we'll just say it like that. How to request accommodations from the school. And then you will literally find a sample letter or multiple sample letters it's like a paragraph or two that really spells out what needs to go into a letter or an email. And it really does have to be documented in writing, you know, because just to ask the school whether they say yes or no won't guarantee that you'll get it, versus if it's in writing, it becomes a formal process that is supported by law.
Thank you for that. This has been a really wonderful discussion. And before we end our conversation today, I would like for each one of you to leave us with a take-home message from today. So if we can start off with Ms. Peace.
Okay, again, thank you very much for this opportunity to talk with the community about what we're doing here. And so again, these are unprecedented times. Knowing that there are people who are still available to help you when you're having issues. So please come see us. We're safe here at Mile Square. And just know that everybody, even healthcare providers, are dealing with all of these things at the same time. So we understand the difficulties that people are having, and we actually have probably a lot more compassion for you all now, even more now than before, because we're all kind of dealing with these same things. I actually will be trying to figure out what the schedule is going to be for my son, who will be a first grader this year, for his screen time. So I understand, and we're all kind of working with these same challenges. So know that there are resources available for you. I'm glad that Dr. Pacheco-Cornejo mentioned that we are FQHC. We will see you regardless of your ability to pay. Even if you lose your insurance in the middle of what's going on now, come see us. We can always help you get your medications at low cost. And preventative visits are still important. So come see us before you get sick.
Thank you. And Dr. Etminan, oh my God, I'm sorry. Etminan, I'm so sorry. I'm so used to calling you Dr. Sue.
Just to piggyback on what Mallory said, scheduling that preventive visit is very, very important. And just make sure you stay safe, you take care of yourself, because nobody can take care of yourself better than you. You could go to the best doctors in the world and you know yourself best, you know your body best, so listen to your body. Come in for preventive visits. If something feels a little bit off, it's worth a phone call. Something that we didn't talk about is we do televisits now. So all you need is a phone. We could do it over the phone. If we want to do it over video, we can schedule it over video. You don't even have to get up off your couch or potentially expose yourself if you still have anxiety or are not comfortable leaving your house. So the one silver lining about all of this is it's forced everybody to be more amenable to things like doing things online, like this program, and doing even medical visits and dental visits online, which are totally possible. So don't hesitate to call and request a televisit if you want one too.
Thank you. And Dr. Pacheco-Cornejo?
It's hard to give a take home. you know, because everybody probably needs to hear something different. But because we're social beings, what I will say is definitely always have access to somebody who has your back, who will listen, who will encourage you, who will make you better, right? That's the point of being in a relationship, whether it's a friendship or a romantic relationship, is to be better, is to grow, is to not stay the same person, you know, that you were in your youth, because otherwise we're just grown children, right? We know that with age, the wisdom does not come. Wisdom is something that you work to achieve, you know. And you all honestly have clearly set yourself apart as wise people, or people who are seeking, you know, to do better, to know better, because you're on this call. I can only imagine what else you do to, you know, to succeed, to move forward. I think this is just a representation of who you are. And so I definitely applaud you all and really appreciate your attention, your questions. Like, you're already in the advantage.
Thank you. Thank you, Ms. Peace, Dr. Etminan, and Dr. Pacheco-Cornejo for taking the time out of your busy schedule to come out and talk to us today. Thank you to the Cancer Center team for putting this event together. And also a big thank you to the audience for joining us this evening and providing us with all those great questions.
Yes.
We found this conversation very insightful. And for those of you who are online, please take a minute to complete our poll. Have a wonderful day and good luck with everybody.
See you all.